all of the housekeeping. Thank you, Jordan. So welcome. In today's presentation, we're going to talk a little bit about EverThrive Illinois, who we are, what we do, but we're going to focus most of our time on sharing with you a bit about how we develop and share an exciting tool from our team called The Gathering. The Gathering is a digital resource supporting birthing people and their families during and after pregnancy. And our community engagement director, Tamala Milan Alexander, will share how we brought together community engaged research, provider input to create this unique toolkit and campaign. She'll also share how we're ensuring that the tool positively impacts provider and patient relationships to advance birth equity. I'm really excited for you guys to hear directly from Tamala. So I'm going to just kick us off with a little bit about EverThrive Illinois before I turn it over to her. So this is really at the end of the day what it's about here. EverThrive's mission is shaped by the fundamental belief that having and raising a healthy family is a human right. And our work is driven by the reality that not all families have the same opportunities and access to resources to thrive. Our mission is shaped by, that's the same notes. For us, realizing this human right means that all people are able to have children if, when, and how they want, and that they can raise the children they do have in safe and sustainable communities. That really is where the reproductive justice framework comes in and anchors our work. The reproductive justice framework was developed by Black women activists and calls on us to consider all of the systemic, societal, and cultural forces that may prevent someone from parenting if and how they want to. This could include things like whether or not somebody has access to the contraception that they most want, but also whether they have high quality, affordable health insurance, whether they have educational opportunities and economic security, or whether they have safe schools and communities. So this, as I said, this framework really anchors our approach and calls on us to think as holistically about people's lives as we can. So with that background, let me tell you a little bit more about how this plays out and who we are. Our mission is focused on achieving reproductive justice in the healthcare ecosystem, and we take a multi-pronged approach to get there. So we partner with communities so that our solutions and ideas are rooted in the needs and desires of people who are impacted by injustice. We lead policy change because we believe that this provides the best path to long-term change and sustainability of our efforts. And we work with those who provide care, like healthcare providers and social service providers, to improve the healthcare system so it doesn't perpetuate harm. We have 4 core values that you see on the screen here. We talked a bit about reproductive justice already. The others include anti-racism, which simply put means affirming the experiences of people of color and working to dismantle racism in all that we do. Centering the most impacted is about partnering with and being held accountable to those who are impacted by injustice. And bold and transformative action is a charge to us to act courageously to create a healthcare system deserving of trust. And finally, all of this culminates in our areas of focus. These are our strategic priorities. These are the areas where our expertise and our programs have the greatest impact and where our leadership makes a significant difference. We are working to achieve birth equity, which means ensuring pregnant and postpartum Black and Brown people receive the highest quality care. We're increasing vaccine competence by addressing the root causes of hesitance, especially in communities that are marginalized. This is work we've done for more than 20 years, but obviously has taken on new urgency in the last 3. And we're expanding access to comprehensive healthcare, including sexual and reproductive healthcare, because we know that expensive health insurance and poor primary care are major barriers to achieving any of our goals. And finally, I always like to talk about Live Our Values. It's not a program, it's about who we are as an employer, as a partner, as a community member. We want to treat all people who are part of the EverThrive network with the same values that guide our programs and missions. Across all of this work, our role is as a catalyst and a convener. We drive change and achieve our mission by bringing together a wide variety of stakeholders and holding space and holding them accountable to improve the healthcare system so that it works better for all of us. Whoops, too far. too far. Okay, sorry about that. So now that you know a little bit about whoever Thrive is, I'm going to turn the presentation over to our Community Engagement Director, Tamala Milan Alexander, who's going to talk about the work we lead under our birth equity priorities, specifically the gathering. So she'll share with us about how and why it came to be, what it is, and how we've employed this program to achieve our mission and how we know it's making a difference. Take it away, Tam.
Thanks so much, Kathy. Thank you very much. Next slide, please. We know that each year across the United States, hundreds of people die during pregnancy or the year after, and thousands more have unexpected outcomes of labor and delivery with serious short and long-term health consequences. The data shows that there are stark disparities in these deaths. Excuse me. Sorry, hold on. In Illinois, Black women are 3 times more likely to die while pregnant or postpartum than their white counterparts. In Chicago, Black women are 6 times more likely to die. It's so important to understand that the vast majority of deaths are preventable, and recognizing urgent maternal warning signs, providing timely treatment, and delivering respectful, high-quality care can prevent many pregnancy-related deaths. Next slide, please. In 2019, we launched the Chicago Collaborative for Maternal Health, CCMH, in partnership with Alliance Chicago to bring together a wide variety of partners to address the root causes of the maternal mortality and morbidity crisis through our hyperlocal partnerships and community-centered education. We led programs to improve the quality of care that pregnant and postpartum people received. We facilitated workshops to help social service providers better coordinate care for folks, and we engaged communities as partners in developing programs and strategies. Through this work, we were shaping policies and practices that impact the care and supports the pregnant people, supports what pregnant people receive, but we were also learning a lot about what community members and providers needed to work better together. Next slide, please. From that community research and our work with healthcare and social service providers, it was clear that plain language resources are needed to bridge the gap between clinical and public health terms and the community's lived experience of maternal mortality and morbidity. And I always say sometimes language is not a foreign barrier. It's sometimes just more about the terminology that, once again, is not something that the community uses on a day-to-day basis. So we launched the gathering in June of 2022. I call this my baby. The gathering is currently a digital resource comprised of a website. They have printable tools, but it's different from the many educational tools available to pregnant people already. In the gathering, we provide new insights and tools that are being used by real people in the real world to bridge the gap between pregnant people and those who support them, like families, friends, and others. So what exactly makes the gathering unique, you may ask? First, we use this tool to educate readers on maternal mortality as a systemic issue. When we spoke with community members, we had many experiences of people who lost loved ones to pregnancy-related death, being totally unaware this was something disproportionately impacting their communities. This perpetuates shame for people who are impacted and really prevents people from coming together to build community solutions, especially when there's no real understanding and education about that. We also provided basic health education and connected people to existing resources to support their health and the health of their family members during pregnancy, labor and delivery, postpartum, what we like to say after you've given birth, but of course, including education on the maternal warning signs. That was so important when we talked about what should be a part of this tool. And the important thing here is the language that we use. All tools are created at a 7th grade reading level. All terms are defined, and we were careful to substitute terms we learned were commonly misunderstood in our community research. For example, postpartum was replaced with after you give birth, as I mentioned, to increase understanding. All of the language and images in the tools and our promotional materials were tested with people in our priority communities, and the images come from those communities, so they are immediately recognizable and relatable, like the bus stop at 63rd Street and the CTA bus and the Green Line and some other images that we thought were important. And then the campaign also included some particularly unique and important elements. We wanted to create, and we created concrete tools, including detailed scripts to help people more confidently navigate care and advocate for themselves, because that's a big part of it, right? So you won't be dismissed or discounted when you're trying to talk about or respond to not getting the care that you need, or our patients and folks in the community are not getting. In the example here, we have provided a script for someone seeking care after they notice maternal warning signs. People aren't always asked if they were recently pregnant and might not think to mention it in a scary situation, right? Which can drastically change the type of care they receive. So the script begins like, "Thank you for seeing me. I was recently pregnant and I'm having very serious concerns about my health. And I'd like to talk to you about it." The script then provides a detailed framework for how to describe symptoms in a way that's most useful to a provider. We also provide prompts like, "I know my body and this is not normal." And is there a test I can have to rule out a serious problem? For once again, for people who are feeling dismissed, because we hear a lot of that in the language, or they're unsure they are getting what they need. And so it's always our duty to ensure that they have the tools that they need, the verbiage that needs to be included, in really trying to help uh, people get the type of appropriate care that oftentimes, and not the patient's fault, sometimes not even the provider's fault, but just not being able to share what's going on with you. And sometimes, once again, that can be a barrier to your healthcare goals. We also provided tools here for pregnant and postpartum people and their families to help them identify bias or inappropriate care. For example, helping people understand that when a provider is dismissive of their labor preferences or making them feel guilty about their health or planning, they might be experiencing racially biased care, and they should speak up or seek help elsewhere. I know that's not always an opportunity, but once again, this is just one of the tools that people can use to sort of help navigate that experience, especially identifying bias and inappropriate care, or not being able to share and be understood when you're trying to talk about the difficulties that you're having. Um, and so this is just a way to make people, folks that are going through this, birthing people especially, how to act confidently in that moment. And while our other initiatives try to impact the quality of care, it is important, especially for birthing people and their support people, to be ready to act if needed. And so once again, this is a way we do that. And finally, we created tools to bridge the gap between pregnant people and their providers. This is where I was most excited. When it comes to understanding cultural nuances in some Black neighborhoods, listening and conversing in simple terms and explanations are always a bridge. As we provide information, we learn from our research to uh, help providers better connect with their patients. For example, we learned the phrase preeclampsia. It's a medical term for a serious complication of pregnancy and delivery that is a leading cause of death. Does not resonate with all people in our priority communities, unfortunately. Sometimes when folks hear the term high blood pressure, a warning sign of preeclampsia, they don't understand what it means or how serious it can be in pregnancy, because this is a well understood issue in the medical community. Providers may not be taking the time to adequately educate people who are at risk or experiencing preeclampsia. And so our provider glossary helps providers understand exactly where the disconnect is and why they need to approach the conversation differently. and give specific language that they can use to address some of those, once again, nuances. Because what people in the community here who are not familiar with this language, they could be missing a huge opportunity to get the type of care that they need and could prevent the death of that person. The gathering is not just unique for its content. Like I said, it's a real tool that we want people using out in the community. So we built a dissemination plan just to accomplish that. We are reaching community members directly by running ads online, facilitating peer-to-peer outreach to get materials directly into the hands of Black women in particular and their families in specific communities in Chicago that are most impacted, right? Getting a message to sink in for people requires repetition, which is why we combine digital and face-to-face strategies to blanket neighborhoods with these messages. And this helps to build recognition and trust in this tool and make it more likely that make it more likely that people will connect with the information, retain the information, and even share the information with their loved ones. And so we have reached more than 65,000 people this way, and our outreach continues. It doesn't stop because this issue is still very prevalent in Black birthing communities. And we're also using the gathering to provide additional training for social service and healthcare providers who serve priority communities. Yes, we are giving them our outreach materials to distribute, but we're also using the materials to educate them on what we learn, help them understand the role that they can have in addressing maternal mortality, and once again, having this tool to improve the quality of care for the people that they work with in the community. And now we're here for one of our outreach workers who is going to share how they connect with people and why this work matters. And once again, this is a short video from one of our longtime outreach workers, Mary Gray, sharing her story.
And just give me 1 second while I get the video pulled up and ready, and cross your fingers and pray to the Zoom gods that this works. Okay. Stop. Now we're gonna go like this. All right. Hopefully folks will be able to see and hear this okay. It's a 30-second video.
My name is Mary Gray. I work for Thrive, Illinois, and I'm an outreach worker. Maternal mortality and maternal morbidity was one of our, I think, best campaigns that we had because it dealt with women of color. What makes Thrive mission so special to me is that we actually care. You know, it's not just about Mary caring, it's about everybody working as a team, trying to get the message out there.
Okay.
Thank you so much for sharing that, Kathy. And of course, the work continues. We are so proud of what we've accomplished with the gathering, and we have ambitious plans for this upcoming year. We are continuing to outreach, expecting to connect with at least 14,000 more people on the south and west sides of Chicago. We're also working to expand the gathering statewide, meeting with our partners across communities in Illinois with high Black maternal mortality rates to introduce them to this tool and help them put into practice with the folks that we know and that we've shared this with. Have come to find out that it's an awesome tool to use to serve families in their communities. And the one way we're doing that is we're looking for ways to update and expand the gathering. We'll be hosting listening sessions to learn more about what the social service providers need to better serve pregnant and postpartum Black women, and also adding resources about maternal mental health and other social determinants of health resources, like housing and substance use disorders, just to name a few. So if you see me send an email from Tamala Milan Alexander, please know that this is really our way. We know that the Chicagoland area has these um, terrible morbidity issues, but we do know that it's happening in central and southern Illinois as well. And so this is our way of really trying to, once again, expand the gathering so it can be inclusive of the whole state of Illinois, and especially where our maternal mortality rates are just tragic, and we can do so much more to help save lives.
Thank you so much, Tam. I really appreciate you sharing your perspective and all of this detail with us about how this tool was created. It's been really exciting to see that development out of the work that we were doing with CCMH and what we've learned from not just healthcare providers and social service providers, but folks on the ground in communities to create this. So I really appreciate your time and sharing this with us. Just a reminder to folks, if you have any questions, feel free to put them in the chat. We're going to be wrapping up here. Probably the most important takeaway for folks is that you can access the gathering. It's an interactive online tool. We also have printable PDFs at the website listed here, thegathering.everthrivil.org. If you don't want to type, you can just go ahead and scan the QR code and get sent right to that website. We encourage you to look at the tool. We also encourage you to think about how, if you are a healthcare provider or social service provider, you might incorporate this into the work that you're doing. We'd be happy to talk more about that, or to share it with folks in your community, in your family, to make sure that they're getting the best information that they can. If you want to learn more about EverThrive Illinois overall, you can go to our website, everthrivil.org. When you're there, there are 3 things that I think you might particularly enjoy. You can sign up for email updates. You'll learn more about our programs, about our accomplishments. You'll receive updates when the gathering has been updated, and we have new tools for folks to use, invites to future events like this. You can also join our Policy Action Network. If you join the Policy Action Network, you'll be alerted to opportunities to reach out to your members of the state legislature, sometimes members of Congress, in support of policy asks that will advance access to healthcare for people in Illinois, but especially for Black pregnant and birthing people. We have a lot of exciting work coming up this legislative session, and definitely want you to be a part of that. This is the first in a series of webinars where we'll be giving short presentations about different parts of our work. The next webinar is coming up in January, and we'll be talking about our role as leaders of the Family Connects, some of the community alignment boards. We're really excited for folks to learn more about that. So you can also find out more about that webinar and future webinars on our website. So this is the last call for questions. I don't currently see any questions. Jordan, do you have any? Do you see any questions anywhere?
Not in the chat, but again, if you guys have any questions, like Kathy said, you can just drop them in the chat or contact him at a later date. So
I just want to reiterate and thank you so much for everyone who joined, especially if you're from the central or southern Illinois community. Please reach out to me about hosting a listening session. The listening session composes, we have questions that we think will get to or be a prompt for a community conversation with a multidisciplinary group of folks that you're working with, your networks, and we can have a sit down and really talk about how do we get this information in the hands of not just patients, but our providers, really able to get people connected, right, and access to those services. And so we just want to be a part of that conversation. We are interested in doing something in person if possible. So if you want to reach out to me, you will be getting my information to share, to come reach out and think about where we could possibly do something in person to have that very important and impactful conversation, so that as we think about expanding the gathering, as Kathy mentioned, that will be very much more inclusive of not just our Chicagoland area, but beyond those borders, where we know that it can also help make an impact in saving the lives and reducing the rates of maternal mortality and morbidity in all communities. So thank you all.
Thank you, Tam. And thanks everyone for joining. For those who joined late, please know that we've recorded the entire presentation. We'll share it with everybody who registered over email in the next week or so, and it'll go up on our website. And this is my contact information, so you can be directly in touch with me if you have any questions or if you want to connect with Tam. Thank you so much and have a great day.